is definitely in the air, and for so many of us, seasonal allergies are upon us. Joining us live now to talk about it, Dr. Jason Lee from CT Asthma and Allergy at Hartford HealthCare. Doctor, thanks for your time this morning. We appreciate it. Seasonal allergies this season, how are they thus far? What are we seeing?
Well, as the weather's getting warmer and nicer, we're going to see more pollens coming out. So we are getting a lot of calls from people who are now complaining of typical seasonal allergy symptoms. I don't know whether this will be worse than previous years. We'll have to see, but we are seeing patients early this year.
A lot of the symptoms, doctor, of allergies are similar to COVID-19 symptoms. What do you want people to know about the difference between the two?
So allergies will cause runny nose, sneezing, itchy eyes, and watery eyes. However, allergies won't cause fever or pain like muscle aches or sore throat, or loss of sense of smell or taste. If you have those symptoms, then you have to suspect that it might be the COVID-19 infection. But if you have a lot of itching, then it will be more because of your seasonal allergies.
Is there any truth to the idea that your body changes every 4 or 5 years and that maybe someone who didn't have allergies 5 or 10 years ago now may suffer from them?
Yeah, you can develop allergies over time. So especially if you move to a new area, then it does take about 3-4 years to develop allergies. But yeah, sometimes people develop allergies all of a sudden. So even in people who didn't have allergies before, you can start to have symptoms at some point. So you have to watch for those symptoms.
You know, you turn on the TV, marketing everywhere for all things to mitigate allergies. If you aren't feeling great and you think it's allergies, what can people do to alleviate some of the symptoms? What are the best practices?
Yeah, you can start with taking an antihistamine. There are a lot of over-the-counter antihistamine. You may need eye drops, or you can start using a nose spray. But wearing masks this year because of the pandemic will actually help because you decrease the amount of pollen that's flying into the nose, and that'll probably decrease the symptoms in addition to taking medications.
Interesting. So the masks help with allergies because we were just having that conversation off air, not questioning masks whatsoever. That said, having that mask on all the time, it can make breathing difficult and the air that's coming in. But you think it's a good thing in the way of sort of mitigating allergies, doctor?
Correct, yeah, because it'll block the pollens from flying into your nose. It won't help with the eyes, of course, but a lot of symptoms are because you're sort of inhaling, so it'll decrease some of the symptoms. It's not going to eliminate all the symptoms, but it should be better when you're wearing a mask when you're outside.
Yeah, and Lord knows there's enough pollen in the air in Connecticut. As one of my former colleagues once said, it's like a big park that we live in. Dr. Jason Lee, CT Asthma and Allergy at Hartford HealthCare. We appreciate your time, doctor. Thank you.
Pleasure.
Well, speaking of parks, another